Okay, hello everyone. My name is Joseph Smith, and today I'll be presenting a PowerPoint slideshow on sleep disorders. The learning objectives for today are to explore the different types of sleep disorders, understand what causes different types of sleep disorders, explore the mental health effects caused by sleep disorders, and understand the different types of treatments for sleep disorders. To start with an overview of sleep disorders, we will define the term sleep disorders. This is changes in sleeping patterns or habits that can negatively affect health. There's different categories of sleep disorders. One of them is insomnia, chronic or short-term, which we'll go in depth on. Another one is central disorders or hypersomnolence. One of those is narcolepsy, which will be another focus of today's presentation. Another category, which we will not be covering, is circadian rhythm sleep-wake disorders, sleep-related movement disorders, and parasomnia, which we will not be covering. The two common sleep disorders we are covering are narcolepsy and insomnia. To start with narcolepsy, this is the sudden urge to sleep, also known as sleep attacks. There can be intrusive sleep attacks where the patient who has narcolepsy falls directly in their REM sleep. This affects 47 in 100,000 people, or 0.05%. Cataplexy occurs too in some patients with narcolepsy, which is a sudden loss of muscle tone or weakness. Cataplexy occurs in 70% of patients with narcolepsy. There are two types of narcolepsy, type 1 and type 2. And type 2 has a similar clinical features to type 1, but hypocreatine neurons are not compromised, and this does not cause cataplexy in that patient. Moving on to insomnia, the inability to fall asleep, stay asleep, or get good quality sleep. This was defined as someone having insomnia for at least 3 nights for greater than 3 months, and that would be categorized as chronic insomnia. Otherwise, it would be secondary insomnia, which is short term. These insomnia can be caused by jet lag, work shifts, school, any type of pattern in your day that messes up your sleeping schedule. It is often associated with stress and anxiety. In patients with insomnia, 12% in women and 6.2% in men, affects 9 to 20% of adults in the United States. To begin with, treatments for narcolepsy. Treatment for narcolepsy are to control excessive daytime sleepiness and other sleep-related symptoms. There is no treatment just for narcolepsy as a whole because they can come with different sleep-related symptoms such as cataplexy, hypnagogic hallucinations, sleep paralysis, and nocturnal sleep disruptions. Excessive daytime sleepiness is treated with stimulants such as amphetamines, Ritalin, and modafinil. An example of one is Bisoxine, which is actually methamphetamine, which is the commonly abused street drug. Cataplexy is treated with antidepressants, a non-selective GABA agonist, and a non-selective GABA agonist means it initiates a response when combined with a receptor. Throughout studies, they have tested sodium oxybate, which is another treatment for narcolepsy. And this targets both the excessive daytime sleepiness and cataplexy instead of just targeting one. Studies have shown improvements in both excessive daytime sleepiness symptoms and cataplexy while taking medications listed above. Here's a video of Rusty, the narcoleptic dog. He suffers from cataplexy, and you'll be able to see here in a second. The emotion spikes, and when that emotion spikes, it takes him right into a deep sleep, and he passes out. Moving on to treatments for insomnia. Benzodiazepines are positive allosteric modulators of GABA A receptors, and that means they change the GABA A receptors' response to stimulus. These cause sedation, like many treatments for insomnia do. Benzodiazepines come with withdrawal symptoms when intake stops. Z drugs are newer non-benzodiazepines, but with the same mechanism of action. And non-benzodiazepines, such as the drugs and orexin receptor antagonists, improve short-term sleep variables. Cognitive behavioral therapy is another treatment for insomnia, and it's a safer option. It can be individual or group therapy, and it's for strategies to improve sleep. The safest way to improve sleep and allow patients to reduce the use of hypnotic medication would be cognitive behavioral therapy, and it has been proven to increase sleep efficiency by around 10%. mental health effects due to sleep disorders. Sleep disorders have sleep has a bidirectional relationship with mental health, but it is impossible to tell whether sleep disorders cause mental health problems or mental health problems cause sleep disorders. Insomnia has a profound effect on physical and psychological health, associated with stroke, asthma, anxiety, and depression. Insomnia also has a great impact, along with narcolepsy, on the quality of life. One can include trouble waking up and getting to work, or doing productive work while on the job. So it can cause a really big disturbance in someone's life, as you can tell by the symptoms. Then here are my references for today's presentation. Thank you for listening.